Hello everyone, my name is Diana Teodorescu. I'm from Romania. Welcome to the World Chemotherapy Day. I'm very thrilled that today I will share with you some of my experience in my work with a group of children and adolescents. I am trainer and supervisor for children and adolescents, and also a trainer and supervisor for groups chemotherapy and for individuals chemotherapy. And I've been working with children and adolescents and groups of children and adolescents for more than 20 years. I developed different kind of programs over the years, and I'm glad to tell you that one of the best models that I've used is chemotherapy. And since I was trained in chemotherapy, this is the model that gives me the biggest satisfactions in my work with children and adolescents and with groups. And even though I know that being here, you are curious and maybe you have some informations about this framework, I will just pinpoint the main concepts in chemotherapy, Jeffrey Young's model, and the main concept being core emotional needs, early maladaptive schemas, schema coping strategies, and modes. And it is very important to know that when we work with children and adolescents, it is very important to have in mind all the time the basic emotional needs, because we have to meet these needs during the therapeutical sessions. We have to train the parents to become aware and to better meet these emotional needs, and also to help our little clients to become aware and of these needs and to asked to be met in a healthy and functional way. So, being a child therapist means to be a good enough parent for these little clients, and also a support for their parents and their families. When these emotional needs are not met, 5 domains of schemas will develop. And what it is important to pinpoint is that we are witnessing the process of schema developing. When they are little, we say that we can see schema dispositions, we can see the process of developing the schemas. And that means that we are pretty lucky to help for preventing the schemas by developing. And we can help parents understand how important it is to meet these needs in order not to let these schemas to develop. So I think that our work with children and adolescents, it is very important also for prevention, not only for intervention. And groups are a very nice setting to do prevention, especially prevention. But until that moment, the moment that I will explain how we can create groups, it is important to take a look at another important concept of chemotherapy, the concept of modes, because we work a lot with this concept. We have different categories of modes, the child modes, vulnerable child, angry child, indisciplined, impulsive child, and also the happy child. And when we work with children and adolescents, we work a lot with these modes from this category. Another important thing is to understand that when we work with children, we witnessing the process of assimilating the critical messages. Actually, children start to interject the critical messages from parents, teachers, caregivers, peers, and inner critical voice starts to develop. And when our little clients are dealing with schema dispositions, when they get triggered, when they are so overwhelmed of emotions on the one hand, and they are hearing these critical messages, of course, they find ways to cope with this, and they use coping strategies, and using over and over these coping strategies, they can develop dysfunctional coping modes. And actually, these dysfunctional coping modes are the reasons that they come to therapy, actually. So, in order to help them solve their problems, we present them this inner world, this inner team of modes. And our best buddies are the functional modes, the happy child mode, who is contented, spontaneous, positive, creative, and the wise and competent mode, who is the mode that brings all the resources, the skills, the capabilities, the qualities that the child has. And when we work with children and adolescents, it is very important to be creative, to be visual, to offer them a visual idea of these modes, and to explain them how these modes, like some inner characters, from movies or from cartoons or from books, create an inner world for us, and in this inner world a lot of things are happening, and our main focus is to help children understand how this inner world functions and how they can use their resources to bypass the difficulties and the problems that they have. And for example, here on the slides, you have the mode sketch. The mode sketch is the sketch of our inner world, this inner world, and exercise. It's called Mode Team, and it is a wonderful activity in schema therapy for children and adolescents, helpful for our case conceptualization and very helpful in our work with children to help them become aware, and also motivating them to team up with us to solve the problems that they came for in therapy. This is another idea of how can we help them to explore this inner world and to understand what's happening in a typical day, who's in charge, how is the team organized when a specific problem arises, and so on. And as you can see, schema therapy for children is very generous in creativity and flexibility in order to help children become aware, and in order to support the motivation to team up for therapy. Of course, individual framework, it's very useful. Yes, we have a lot of results, but over time I observed that groups can bring an extra can bring some extra results and also faster results. And first of all, because the group is the good enough parent. Actually, all of those 5 needs are met during group work because the group offers connection and safety and stability and acceptance and belonging. And sometimes in school or in their group of friends, they not necessarily get all these things, and sometimes they struggle to integrate, to adapt to the group or to the school where they are. Second, they learn to develop new skills. They learn from each other. They practice with the group and they get guidance and validation from us. And it is a safe place to develop new skills and new competencies. And also, in the group setting, they are allowed and encouraged to express themselves, and we accept their opinion and needs and feelings and emotions. And also, we play a lot and we meet the need of spontaneity and play. And we play when we work and we play for fun. And nevertheless, the group has structure and consistency and offers the opportunity to practice self-control. And when we meet all these needs in a group setting, half of the work is done by the group. And us as therapists, we have to coordinate, of course, to offer everything that we have on our agenda, but the support of the group and this idea of the group being the good enough parent, it is very helpful and enriches a lot our results. We can create different kind of programs for children and adolescents, and this is what I like when it comes to this model, that we can be flexible and we can create different kind of programs. For example, we can use this framework to create psychoeducational programs for schools, for kindergartens, or psychoeducational programs in our private practice. And we use all the knowledge that we have from the schema therapy protocol to psychoeducate children, adolescents, and also parents. We can create groups of parents to do psychoeducation in terms of emotional needs, schemas, and modes. We can create personal development programs, and that means that we can create a setup to develop skills and capabilities, to develop the wise and competent mode, and to show children how they can rely on the wise and competent mode and on their skills and capabilities. And of course, we can create group therapy programs, and that means intervention. That means to develop programs with therapeutical goals for different types of difficulties. And when we create such a program, we have to take into consideration some important aspects. For example, who is the target group? Whom are the children or teenagers that we have to adapt our program to? There are children in kindergartens, there are children in schools. We have to adapt our program for a specific type of school. And when I say that maybe there is a private school with some specific requirements, maybe it's the public educational system with other specific requirements. So we have to see who is our group and what is the purpose of the program. Yeah, who is the beneficiary and what they want from this program. And of course, we have to set some goals for the program, and according to these goals, to choose some topics. Yes, and after we have the answers to these questions, we can create the structure of the program and at the end to set some criteria in order to evaluate the program. And when we have the answers to all these questions, we can tailor the program adapted to the requirements that we have. And over the years, for example, I developed psychoeducational programs for different schools or kindergartens, or I offered psychoeducational programs for parents who wanted to know more about the emotional needs and how to meet them. I also developed personal development programs for some schools and kindergartens, and I had programs that they were developed for 1 year or for 2 years in a row. And I also developed short programs for 3 or 4 months. So we can adapt to the requirements that we have. And when we have those requirements, we have to decide some selection criteria, the group size, and the recommendation is to work with 8 to 12 children, but sometimes schools ask to work with 20 children, so that means that we cannot do a therapy group, only psychoeducational group. Of course, we have to take a look at the group structure. It's preferable to have boys and girls. It's preferable to have same age children, and when they are little, not to have age differences more than half a year, 1 year between them. And of course, we can adapt the structure of the session according to all these requirements that we have. When we work with children and adolescents, it is very important to be vigilant on the group stages, because if they know each other, for example, if they belong to the same classroom, the same school, if they know each other, it is easier when we do the activities for cohesion. They already know each other. And it is more difficult if they come in private practice and they don't know each other. So we have to dedicate more time for formation, cohesion, and bonding. For the conflict stage, again, there are some differences. When we work in a school and they know each other, they can bring conflicts from other moments, and we have to set some limits. And when the group starts to work, our facilitation is lower and we offer a lot of guidance, and we are careful to meet all those 5 categories of needs. And it is wonderful to see the autonomy of a group when they start to support each other, when they start to help each other, when they start to learn from each other. And when they put aside the critical messages and they are no longer ashamed of what they are saying, what they are doing, and they rely on each other. So this is the moment when we are so grateful for what we've done there, and there are so wonderful results. Yeah. When we create activities for groups of children, we have to be very careful to have this structure in 3 phases. We always have to have an introduction, yeah, to a check-in, to see how they feel, to introduce a little icebreaker. If they are too low, to bring an energizing exercise. If they are too high, to bring a calming exercise, and to create a safe space for them. After this, we bring the main activity because we have some goals, yes, and we introduce our activity with a story, with a metaphor, or with a little game or video. And after this, we actually do the experiential work, yes, because it is very important to do only experiential work to help them go through the activities. And at the end, very important is to process, yeah, the processing phase when they share experiences, they noting similarities, we offer validation, and very important, we help them transfer um, the gains of that session to day by day life. Yes, in order to develop the wise and competent mode. So no matter what the group size is, no matter the setup is, we always have to have all these parts of the activities. Never let an activity without processing, without transfer to day by day life. Of course, when we work with children and adolescents, we have to adapt our content to the chronological age of the group, but more important is to adapt it to the cognitive, emotional, and social developmental level. And for this, I usually make a selection, I make an interview, and when I create the group, I'm taking a look not only at the chronological age, but also at the level of development. And we have some specific goals and some specificities when it comes to schema therapy groups of children and adolescents. First of all, the group and the therapists are the good enough parents, and that means that we have to create a warm, protective space for these children, meeting all the emotional needs. Second, it is very important to focus on the wise and competent mode, to do a lot of awareness work and to develop the skills or to enhance the skills of the wise and competent mode. We have to know which are the resources that we can rely on. Again, very important, our focus on the vulnerable child, because these children need to be seen, to be heard, and therefore we have to be attentive all the time and focused on the vulnerable child mode. Of course, if we do a therapeutical program, We have to identify modes, schema dispositions, to explore triggers, to do a lot of mode awareness activities, and to bring specific work for intervention for each mode, and at the end to do the transfer to day-by-day life using the wise and competent mode. If we decide to create psychoeducational programs or personal development programs, we will focus more on the wise and competent mode. And I am very happy to present a bit of my model for the wise and competent model that was developed especially for these groups of children to help them see how many resources they have and how easily they can develop this wise and competent mode, and how wonderful it is to rely on this mode. And for this, I created 12 pillars, 12 categories of skills and competencies, and I called them helpers. Children and adolescents know that these are helpers. And my programs are built on these 12 pillars, and I create a setup in order to develop each of these pillars. And that means that at the end of the programs, they are aware of their resources, they know which are their best resources, and also they become aware of the work that they have to bring in order to enhance or to develop other skills and resources that they will need. And in the group setting, it is great that they can learn from each other and we can rely on each other. And here are these 12 pillars. Unfortunately, we do not have the time to go through all these pillars, and this presentation is only to show you how many wonderful things we can do in the group setting. So using these pillars of the wise mode, we can create psychoeducational programs and personal development programs. And the goal is to explore the wise and competent mode and to create a team of helpers for each child and to create a toolkit of activities for each of these pillars. And we can use all the resources of the group in order to develop a wise and competent mode. And that means that they can transfer to day-by-day life a lot of resources that they are learning during these groups. But of course, we can create a group protocol for children and adolescents. And because in schema therapy, we do not have a validated model like the one that we have for adults, created and validated by John Farrell and Ida Shaw. A few years ago, I started to validate the protocol for children and adolescents using the model of John Farrell and Ida Shaw, because that is the group protocol that is validated. And following their steps, I created the protocol, and I am very happy to have the first results of the pilot study. And what we've done in this protocol is to follow the structure of the protocol for adults, but we adapted that protocol for children, and the pilot study is for children. And we developed a program that also focuses on wise and competent mode, and we um, enhanced the skills and capabilities of wise and competent mode, but also we brought exercises and activities in order to do mode intervention on a very structured case conceptualization. And during this therapeutical um, protocol, we focused on each mode, following the steps of John and Ida's protocol. So we also focused on dysfunctional coping modes. We adapted the activities in order to work in a group setting with dysfunctional coping modes. We also dedicated sessions and time to work with the vulnerable child. In some specific groups, if the impulsive and the disciplined child was there and we had a goal on our agenda, we worked on the impulsive and indisciplined child, and nevertheless, of course, on the angry child. And especially adolescents want to work a lot with the angry child. And we also adapted the activities of working with inner critics. And of course, each session we integrated a happy child activity in order to follow all the stages of the group schema therapy protocol. And we have started already to present our ideas and our work. And I invite you next year at Inspire conference. And probably at Inspire, we will present our results for the pilot study, for validation, the group schema therapy protocol for children. And maybe in the next year, we will validate the protocol for adolescents, because the first step was to work with children. So these ideas are here in order to show you how important is to bring this setup, the group setup, in our work with children and adolescents. And because I trusted these results in the group setting, I developed this program and validation study. And the results show us that the group setting, it is the good enough parents for children and adolescents, and it can bring wonderful results. And the results can come faster, and they are deeper, and the transfer to day by day life help children to create functional and healthy strategies to deal with problems and to deal with this world. Thank you so much for being curious. If you have other questions, this is my email, and I hope that we will see each other at the next events of ISST, and we will see each other in Thessaloniki at the conference. And my biggest wish is to send this message to you that group work with children and adolescents brings a lot of results, a lot of satisfactions, and children love to share their experience with each other. And at the end of each program, they are grateful for being part of that group. So I encourage you to integrate the schema therapy framework in your work with children, with adolescents, and to have the courage to develop programs for groups of children and adolescents. Thank you so much, and I hope that I will hear from you good news about your programs. Thank you.